Hello, I'm Dr. Paul D'Egidio, founder of Virtu Cosmetic Surgery. Thank you for choosing one of our offices for your consultation. Over the next few minutes, I'm going to give you some important information about having an elective cosmetic surgery. This is a very exciting time to discuss your goals and finalize your plan with your doctor. Each one of our physicians will review your history and develop a plan with you to minimize the risks of your surgery. Our providers meet with you pre-op to develop that plan and at regular intervals post-op. These post-op appointments are generally at 1 week, 6 weeks, 6 months, and a year after surgery, and certainly more frequently as needed. There are 5 common risks with a procedure to consider, and I'd like to ask for your help to make your recovery as uneventful as possible. For elective cosmetic procedures like this, the risk of an infection is around 2 to 3%. We may place you on an antibiotic after surgery. If so, please take the entire prescription and don't stop early. By following the directions from the pharmacy and your surgeon, we can work together to reduce your infection rate to less than 1%. A blood clot, or DVT, is a complication where the blood in your legs can get too thick due to the decreased activity levels and increased inflammation from surgery. DVTs can present as painful leg swelling. Thankfully, this is rare. The risk of a blood clot itself is 2 to 4%, and it varies based on the specific surgery that you're about to have. The risk of the blood clot traveling to somewhere more serious is much lower and well under 1%. By getting up and walking for about 5 minutes each hour during the first week of recovery, we can minimize this risk to much lower than that. You don't have to set an alarm or get up and walk in the middle of the night, but it's important to be very active during the day. If your risk factors are higher than average, your provider may put you on a blood thinner for a few days after surgery to decrease this risk as much as possible. Bleeding occurs in 2 distinct phases, early and delayed. There will almost always be some bruising after surgery that goes away in the first week or 2. The more concerning problem is the rapid bleeding or hematoma. This generally occurs in breast surgery around 2 to 3% of the time at the 1-month mark. This happens in a delayed fashion because you're feeling pretty good at that point and starting to get back to activities and may overdo it. It's very important to remember that there's a 5-pound lifting restriction for 6 weeks after surgery. No pushing, pulling, or going to the gym. We already said that walking is good to prevent DVTs, but power walking is not good. Getting your heart rate or blood pressure up or exerting yourself to the point of breaking a sweat can cause the blood vessels to rupture. After a breast surgery, for instance, a hematoma will cause one breast to become twice the size of the other one. It hurts a lot, and you have to come back for another surgery within a few days to clean out the bleeding and prevent scar tissue problems down the road. Delayed wound healing means that the incisions did not completely close the first time like we wanted them to. Sometimes it's a small scab that falls off and heals within a week. Other times, like with an extended tummy tuck or an anchor breast reduction, it can take a bit longer. Your doctor will develop a custom treatment plan to make sure that things heal as quickly as possible. Plastic surgeons are wound healing experts, and it's important to trust the process and let the team take care of you, rather than getting advice from the internet or from another healthcare provider. Seromas are pockets of fluid that accumulate underneath your surgical sites. Depending on the procedure that you're having done, your surgeon may place a drain to evacuate this fluid and prevent it from accumulating in the first place. Not all procedures need a drain, but if you do need one, we will review how to take care of it before your procedure and send you a video on how to manage it afterwards as well. In summary, having an elective cosmetic surgery should be a safe procedure for you with less than 5% risk of any serious complications in the first month. Said another way, over 95% of people have a great experience with no complications at all.